from Wisconsin. Ms. Moore to inquire.
Thank you so very, very much, Mr. Chairman, and so wonderful to see you, Mr. Secretary. Notwithstanding the polemic from our colleague, Mr. Jason Smith, I really appreciate the President and your department putting a racial lens, an equity lens, quite frankly, in your budget. I appreciate your recognizing, for example, that maternal morbidity and mortality mirrors so-called third world countries among African American women and women of color. And I appreciate that as a black woman and mother, and someone who has really put legislative efforts forward to do this. I appreciate, and I'll ask you if I have time, about the $20 million you're putting into doula training. I also appreciate your making the HHS, the Indian Health Services funding, mandatory instead of discretionary. Again, another move towards some equity. And I have legislation I hope that this body will support to provide scholarship and loan benefits under the IHS for Native students that are similar to the National Health Services Corps, where they will be tax exempt so that we can recruit professionals. It's with regard to the cancer moonshot, as an example. The racial and equity and ethnic minorities are not represented well in clinical trials. And I'm hoping that there will be some effort toward that. I'll give you a good example. Black women disproportionately have dense breast tissue. And so a regular mammogram will not pick up those changes. And so I often wondered why the mortality rate among black women was so high. Regular mammograms don't pick this up, but the test that does pick it up costs $2,000, and it's not paid for by insurance. I appreciate your focus on equity and child welfare. As you know, black women, women of color, are disproportionately having their children taken from them, and I believe it's for poverty, not because of neglect as much. I'm really interested in portions of your budget that focus on community violence. There's a $100 million grant, and I was hoping that that would lend itself to de-escalate community de-escalation training that I have been proposing legislatively. I want you to respond to that. Also want you to respond to what's gonna happen at the end of the public health emergency, besides just a 60-day notice to the states. How many people will that affect in terms of losing health care? And again, why did you think doula training was so important? And I'll yield to you for those responses.
Congresswoman, thank you for bringing up so many important issues. The doula training is important for the reasons I've been trying to articulate all morning, and that is that the more we focus on prevention instead of remediation after someone has become ill or is harmed by a medical condition, the greater the savings are for America, but the better health for that individual patient. And so the money that we devote to doulas is to make sure we're getting to people early and providing them with the help, the support, and the in some cases, the training and services that those individuals could use to actually better care for themselves. And so it's a great investment, pennies on the dollar for the return, right? And so we will continue to move in that direction. The same thing with maternal health. We're gonna make sure that if a woman is going to deliver a baby, it behooves all of us to make sure it's a healthy delivery, because not only is it good for baby and mom, but it's good for America if that baby and mom are spending more time in the hospital. So we'll continue to make those kinds of investments.
Thank the gentlelady.